Let's talk vaccines now. Delighted to be joined by the Director of the Communicable Diseases Department at Abu Dhabi Public Health Centre, Dr. Farida Al Hosani. Dr. Farida, good morning. Thank you for being with us.
Good morning, Richard.
We have so many questions from our listeners about vaccines and vaccination, so let me jump straight into them. First of all, can you give me the latest numbers that you have about how many vaccines have been administered here?
So far, we reached in UAE around 2.4 million doses of vaccine administered across United Arab Emirates, which is around 25 per 100 people in terms of rate. We are now number 2 globally in terms of the number of doses vaccination administered.
Do we have a breakdown on how many of those were Sinopharm, how many were the Pfizer vaccine, and perhaps even how many were the Sputnik vaccine, which has recently been approved for emergency use?
Well, unfortunately, I don't have that split down, but I know that majority of them are from Sinopharm vaccine.
Okay, thanks very much indeed. Now, let's talk about second doses. Lots of speculation in the global media, as well as here in the UAE, about whether you do or do not need to get your second dose and the efficacy of having just one dose. What can you tell us about that?
Well, I think the duration of the second dose was stated or defined based on the study. So the day 21 in Sinopharm is really the ideal time where you need to take the vaccine to make sure that your immunity reach its maximum level. So I would advise everyone to stick to the schedule and try not to miss the second dose. And if they need to reschedule it, try to make it within a couple of days, not more than that.
Well, getting on to the second dose, we've had more questions in about this than I think anything else. For example, one of our listeners, David, writes in, maybe you can help David, Dr. Farida, saying, I had my first Sinopharm jab on January the 10th, and I was advised to come back 21 days later. But David's just had an SMS which has pushed back his second jab until the 11th of February, which will be more than a month after his first jab. And here's David's question. Is there a shortage of the vaccine at the moment? Is that why his second jab is being put back, Dr. Farida?
Well, it's really difficult to answer him if I don't know which vaccine he is taking.
Sinopharm.
Sinopharm. Usually 4 weeks, again, it's acceptable time. The range is usually between 3 to 6 weeks. But the ideal will be 21 to 28, 30 days, which is still within the acceptable range. There is no short of supply that I know of, but it might be good to call the clinic and reschedule it if possible.
In terms of the different vaccines, Dr. Farida, we have the Sinopharm, we have the Pfizer. We know they're very, very different technologies. And within the past few days, we've had the Sputnik V, the Russian vaccine, has been approved. What can you tell us about the Russian vaccine? How does it work in simple terms compared to Sinopharm and Pfizer and the efficacy of that vaccine?
Again, it's really advantage to have more than one vaccine in United Arab Emirates because it provides options for individuals to choose. The Sputnik vaccine is usually based on inactivated adenovirus. There is a part of the SARS-CoV-2 virus inserted within the adenovirus. So it is really very weak virus, but again, it provides a good immunity. With regards to the initial results, it's really the study has been done in more than one country, including Russia and United Arab Emirates as well. I don't really recall the numbers, but there is a good efficacy and safety results that has been shown in this vaccine. So UAE is one of the countries that currently have the emergency authorization for this vaccine.
Good morning, Dr. Farida. I know you've just said there that we don't have a shortage. There are those concerns and rumours doing the rounds about the supply of vaccines here. What can you tell us about the supply of both vaccines into the UAE?
Well, I can tell you that the supply for COVID vaccination, the global supply, is really an issue in different countries. You know that many countries did not get even the chance to get any doses so far. UAE have really worked, the government have worked very hard to ensure that we have more than one vaccine. We are starting early on, and to ensure the continuity of the supply. So I think I would like to reassure people that we are doing our best to ensure your safety and your health and the availability of the vaccine.
Dr. Farida, great talking to you. Appreciate your time this morning. Thank you very much indeed for speaking to us and answering our questions. Just before we let you go, the question about people who have been vaccinated, like many of us in this studio, and whether or not we can transmit the virus. So many questions keep coming out on that. What can you clarify about that?
Well, I have to clarify that the chance of getting the infection after the vaccine is much, much lower than if you did not get the vaccine, but the chances are still there. So you might be prone to get the infection, but what the vaccine even provides is really the prevention of the complications of the disease. So even if you take the vaccine, I would advise you to stick to the precautionary measures and not and adhere to it, because it helps to protect you and protect your beloved ones.
That is the voice of the Director of the Communicable Diseases Department at Abu Dhabi Public Health Centre, joining us on the line from the nation's capital, Dr. Farida Al Hosani.